The City of Dublin Natural Gas is growing to meet your needs by partnering with the community, like Moore Station Village, Master Circle, The Legends, Walkridge, Live Oak, Benton House, Waterford, and Greystone. Examples of true partnership with the community. That's Dublin Natural Gas.
We have served you for over 20 years, and we are owned and operated by physicians that are on the cutting edge of cancer treatment. You never have to drive miles and miles to get state-of-the-art treatment with the most advanced technology that allows us to treat cancer in a higher and more effective dose. CurePoint accepting patients right now. Call us today at 272-2255. CurePoint Cancer Treatment, Bellevue Road, Dublin.
Y'all for coming today. I'm Tracy Morgan. I'm the Director of Marketing here at Fairview Park Hospital, and this is our community seminar series that we have the pleasure of doing at least once a month, sometimes twice a month. And we're fortunate today to have our ENT docs with us, and I'm going to let Karen Carswell introduce them.
We are very excited to have two of our ENTs. Dr. Diane Davis, of course, started the practice. David Kellam came on shortly thereafter and has been in practice for 23 years. Right? Since school. Okay, I'm making you a little bit older. Dr. Mullis joined them. They both went to MCG for medical school. Dr. Kellam went on to Emory. Dr. Mullis went on to University of Mississippi. Am I correct? We are really happy. They're very involved in the community. They have young children that keeps them very involved. Dr. Mullis has 4. Dr. Kellam has 2, and we just love that they're here at Dublin taking care of patients locally. So there's no need to send any of your ENT surgeries anywhere else unless these 2 guys say they need to go. So we appreciate y'all being here. Thank you.
First, just start out talking about ear disease. And, we hear the word earache, and there are different reasons we have ear pain. A lot of pain in the summer. Here we're coming to the end of the summer, but a lot of what we see is otitis externa, or swimmer's ear. And as the name implies, it's usually associated with water exposure, but it's frequently seen in children, but also in adults, and it can be associated with other conditions like diabetes and dermatitis. Patients who are prone to eczema tend to have this problem in some cases, but sometimes it takes a good exam to sort the problem out and know whether it's simply otitis externa or something more. Otitis externa is generally treated with topical ear drops with good results, and there are a few rare cases that we might treat it with antibiotic therapy orally. But as we said, the middle ear infection, the otitis media, is what we see more commonly in children, and I've got a slide here that depicts that, and you can see the fluid level in the space behind the eardrum there. And that's the space we call the middle ear, as opposed to the canal towards the outer ear where the otitis externa is involved. But frequently we do see the middle ear infections in children, and I'll go back to this slide. Most commonly, this problem is associated with colds, viral infections, and it's not always treated with antibiotic therapy right off the bat. There are many times that observation is appropriate for a day or two, because I think 40% of otitis media, that is the middle ear infections, are due to viruses. But if things aren't better in a day or two and the fever or pain continue, then often it is something that requires antibiotic therapy or other treatment, which Dr. Mullis will get into. But the other risk factors for otitis media are Obviously age, we see it far more commonly in young children, and heredity, of course. Family history means a lot in so many things, and the ear disease is like that. Ethnicity is important, with, for instance, American Indians have a higher incidence of middle ear disease. And then, of course, the environment we live in, not only is our family history important, but daycare exposure, secondhand cigarette smoke exposure are issues. So we try to remind parents that all these things are a negative with respect to ear disease, and also, sinusitis, which we'll mention later. But in a perfect world, all the mothers could stay home and we wouldn't have the daycare issues and the sharing of germs that we do. As we said, when there is ear pain, often it does take a good exam to diagnose the problem and distinguish whether or not it's an otitis externa or swimmer's ear versus otitis media. Otoscopy is what's used. As you can see here, that's our view of the eardrum. Sometimes we use other tests like pneumatic testing, or what we call a tympanogram, to massage that ear and check the mobility of the ear and see how well it's moving, and that tells us about the hearing indirectly. We sometimes will do hearing tests to assess ear problems. And again, getting back to the middle ear, we mentioned colds and flu, and sometimes allergies aggravate the middle ear and lead to this. And I'll just point out here the health of the middle ear depends on this eustachian tube, which leaves the middle ear and drains into the nasopharynx at the back of the ear. So anything that impacts that eustachian tube, whether it's allergy, sinusitis, viral issues, they all tend to negatively affect that environment and cause otitis media. So I'll stop here as far as the background on ear problems, and I'll let Dr. Mullis talk about the treatment that we generally use and our overall rules and guidelines we follow.
Thank you all for having us. Just to echo what Dr. Kellam said, it's not always obvious when you have an ear problem what's causing it. And we see a lot of people who come in who've had problems with their ears going on for weeks or even months and have been told they have ear infections, but maybe don't really know if it's an outer ear infection or what we call a middle ear infection. That's the otitis externa and the otitis media, and the treatment is completely different. Okay, and so people who diagnose themselves at home sometimes, who maybe try to buy things over the counter or try to treat themselves with a drop that their sister had or something like that, may not be treating the infection properly. So when Dr. Kellam's talking about the otitis externa, and he's talking about an infection here of the ear canal, okay, if you give just pills for that, it typically won't work, okay? And the same way with otitis media, if you have an infection behind the eardrum here, if you give ear drops that go down the ear canal, as you can see, they're going to get stopped by the eardrum, and it's really not going to make much of a difference. So getting the right diagnosis is the biggest issue. And all these things can be complicated by earwax and other problems too, which can make it tough. So a lot of times when you come into the office, we'll study your ear under a microscope to try to see exactly what's going on. The first thing about otitis externa, the ear canal infection, is that it hurts really bad. I mean, sometimes people even have to take pain medication for it because it hurts so bad. But typically, the way to treat that is to clean the ear completely out. So typically we'll do that in the office, use different instruments that we have under a microscope to clean all the wax out of the ear, any of the infection or pus that's in the ear. We'll clean all of that out thoroughly. And then we'll typically use ear drops, and the antibiotic goes straight to the source of the infection, and typically we can get you better very quickly within a matter of 3 to 4 days. You may have heard of people having things put in their ears by doctors called ear wicks. Sometimes we have to do that. If the ear is really swollen badly, we have to use an ear wick to help deliver the medication down to that area. Occasionally we'll have a real stubborn case that doesn't get better quickly with ear drops, and sometimes then we'll have to use different antibiotic pills or even take samples of the ear and send it off to the lab to have them look at it. But I'd say 9 times out of 10 with the proper ear drop we can cure that infection relatively quickly. And just as a side note, about as I was sort of making a joke about using your sister's eardrops, but you'd be surprised the number of people that do things like that. You have to be very careful with the ear, because if you have a hole in your eardrum, which you may not know, if you've had a bad ear infection and had pain, it's potential you could have ruptured your eardrum. Certain drops are not safe to be used with a ruptured eardrum. People put peroxide in their ear a lot of times. That's probably not a safe thing to do if you've got a hole in your eardrum. Whereas vinegar can be used with a hole in the eardrum. So these are the sort of things we can sort out when you come in and let us decide the best thing to do.
The Cancer Center here in Lawrence County is Dublin Hematology and Oncology Care. We have been serving the Middle Georgia area for the last 10 years. Don't settle for anything less than the very best when it comes to your health. If you are a cancer patient, get a second opinion from Emory qualified physicians at no out-of-pocket cost to you. That's right, Dr. Kazi and Dr. Agarwal will give you a second opinion at no cost. Dublin Hematology and Oncology Care, Hospital Drive in Dublin.
Get a tire with stopping power and some extra spending money. Just drop by your local Michelin dealer between now and September 3rd, 2012 and buy any set of 4 new Michelin brand passenger or light truck tires and get a $70 prepaid card after rebate. Stop by Duncan Tire, 301 Telfair Street or 1112 Hillcrest in Dublin. Duncan Tire has the expert tire service you need to take your car's performance to the next level. See redemption form at participating dealers for complete offer details. Offer expires 9/3/12. Void where prohibited.
SCAG is heavy-duty performance with unmatched control and maneuverability. SCAG is rugged durability with heavy-duty construction and the toughest components in the industry. SCAG is commercial-grade mowers. SCAG mowers can cut your mowing time in half while delivering an incredible quality of cut. Proudly manufactured in the USA since 1983, SCAG is simply the best.
See the all-new SCAG mowers at Freeman's Lawn and Garden, 441 North, Dublin. Since 1954, Lake's Alignment has stood behind every job they've done. Ep Lake and all his technicians are among the most skilled and experienced technicians in the industry. You can be assured every job is done right, from front-end work to brake work, or choosing the best tires for your vehicle. Lake's Alignment carries a full line of tires, including quality Toyo tires. Count on the best. Choose Lake's Alignment, located just off Central Drive at East Dublin. Call 272-4230. Allen's Heating and Air is your licensed Amana equipment dealer. Trust Allen's Heating and Air to install and service your heating and air conditioning unit. Allen services all brands. With the purchase of a new Amana unit, you'll get a lifetime warranty on the compressor. Allen's Heating and Air. Call Sean Clark or any of his friendly staff at Allen's Heating and Air. Amana Heating and Air Conditioners. Last and last and last.
Now, otitis media is a little more straightforward in adults, the infection behind the eardrum. That's an infection that eardrops typically are not going to fix, although there are some drops we can use sometimes to help with the pain itself, just some numbing drops. In small children, there's more argument about whether they need medications or not, or should they just be allowed to get over it on their own. But in adults, most of the time, if you come to the doctor, that infection's probably been bothering you for quite a while, and we typically will use antibiotic therapy if it's an actual infection built up behind the eardrum. Sometimes we'll also prescribe nasal sprays to help with the eustachian tube that Dr. Kellam was talking about, to help that fluid drain out of the ear that's causing the infection. And very rarely, but we do have to do this sometimes, actually make a hole in the eardrum and drain the infection through. Even in adults we see adults who've never had an earache their whole life, and they come in at 60 years old and now start having ear infections over and over. We can't really explain why that happens, but it does. And occasionally we even have to do, that procedure to drain the infection off of the ear. One more thing I'll touch on briefly before we switch over to sinusitis is earwax. We see a lot of people with earwax problems. Some people may go years with no wax problems and then develop wax problems. We don't really know why that is necessarily, but different skin conditions can cause problems with wax buildup. People have all different sorts of things they try to get wax out of the ear. The one thing I would say, and I think Dr. Kellam would echo this, is don't try to clean your ears out with things you pick up off your counter at home. And we see a lot of people that use bobby pins to scratch their ears and clean out their ears. I see parents giving their small children Q-tips to clean out their ears. That's not the thing to do, okay? We see a lot of eardrums that get ruptured by sticking things in your ears. We see a lot of ear infections from hurting the lining of the ear canal with things that you use to scratch your ear with. So we don't recommend any of that. We don't recommend ear candles, okay? All the studies on ear candles that you may have heard about, all the studies show that it's not beneficial, okay? What you're getting out of your ear is just the smoke and the ash from the ear candle, so we don't recommend that. We typically use drops to get the earwax buildup out, or we need to actually clean it out ourselves under a microscope where we can see exactly what we're getting out. So if you have wax buildup problems, that's another thing we're trained to take care of for you. Any questions about ears?
What if you have tubes in your ears, and I don't know how often you have to have them cleaned?
If you have ear tubes put in, which is typically children, but we do occasionally have to do that for adults. We don't really have to do much to maintain those except keep an eye on them. We rarely have to clean out the tubes. Sometimes they get clogged and we have to clean them, but that's pretty rare. We just have to see you every 3 or 4 months.
What if you're 93 years old and you have that plug in your ear and it might need to be cleaned?
When you say the plug, what do you mean?
I mean, they put a tube in her ears.
Okay.
I know my neighbor's ear, they put a tube in her ears.
Uh-huh.
And she's having problems. She said sometimes she hears ringing in her ear. How often should she come back and have them cleaned?
Probably around every 3 months or so. But if she's having problems like ringing, that's something we should look at to see if she needs a hearing test and to make sure the tube is working.
All right.
Is it normal for as you grow older, or you have less wax?
That varies. Sometimes it seems like we get more wax as we get older, and some people seem to go from making a lot of wax to making a lot less wax. The color seems to change, the thickness seems to change, and I don't have a good explanation for that, to be honest with you. I don't think anybody really does, but it does seem to change over time.
If you believe that investors should be heard, not herded.
If you have the audacity to believe I can see you in 2 weeks is quite frankly weak.
Join the nearly 7 million investors who think like you do. FaceTime and ThinkTime make a difference.
Join us.
Join us.
Join us. At Edward Jones, it's how we make sense of investing.
And another great thing about Oconee Fall Line Technical College is you get hands-on experience. It makes a big difference to employers. So call OFTC, enroll, and get the education and training you need. While you're at it, ask about financial aid and student loans. Yes, there's still hope and help. And after graduation, OFTC even helps you find a job. You did write those numbers down, didn't you?
A touch of Italy in the heart of picturesque rural Georgia awaits at Dublin Farm, the area's premier lodging destination. Complete the perfect romantic weekend with a stay in our beautifully appointed country-style bed and breakfast. Or simply join us at the Ristorante da Maria Fridays and Saturdays. Our menu boasts an eclectic rotation of authentic Italian cuisine, made with only the freshest ingredients. Don't forget to sample our meticulously selected collection of wines. Discover Southern hospitality with an Italian twist. Book your reservation at Dublin Farm today. Come home to the country.
Also, as growing up, I had fluid build up in my ears. And over time, like you said, they put, sweet oil as a child,
Sure.
And stuff like that in my ears. But over the years, my eardrum has hardened. Is there anything that can be done, to soften it, or does it have to be replaced? Or?
That's a more difficult problem. If you have scar tissue that builds up in your eardrum, the name for that is laryngosclerosis, which is sort of a long word, but it just means hardening and calcification of the eardrum. We see that in people who've had a lot of infections, a lot of eardrum ruptures, ear tubes placed, or surgery on the eardrum. There's no magic medicine or eardrop that will just soften that up immediately. Very rarely would you recommend surgery to try to replace that, because typically it's almost impossible to do a good enough job rebuilding a large part of the eardrum if it's hard. Sometimes that can cause your hearing to be bad, and if it causes a big enough problem, sometimes treatment is indicated, but that's a tougher problem to deal with sometimes.
Well, like you said, Dr. Davis, I had been to her, and she outpatient. She went in to check it, and she said the eardrum has hardened. She couldn't even, whatever it is that y'all do, she couldn't penetrate it, and she suggested hearing aid would help. But I was just wondering, continue using a hearing aid, or is there any cure for it?
Well, again, that's a more difficult problem without looking specifically at your ear, feeling of your eardrum and things like that, which we could do in the office under the microscope and testing the hearing again. But it's possible, but it's a little more difficult.
Right. One other thing, back to the washing of the ear.
Right.
Me being a Georgia girl, I've been used to gnats all my life, but I was out cutting scrubbers just this past weekend. All of a sudden, one goes in my ear. Never have had that to happen. And it buzzed like it must have been this big. So I thought, trying to get it to come back out. Of course, it's not coming out. So I go in the house, and I don't know whether I used bobby pin and killed any little booger, or if it came out. What is the best way to handle a situation like that?
So if you're sure that you don't have a hole in your eardrum,
well, see, I do.
So you do. So if you
with the hole, I don't know.
So with the hole in the eardrum, the best thing for you to do would be to come see us.
Right, it was just like buzz like this, And I said, well, I've been in Georgia all my life with gnats, but never had one.
It's a much tougher situation if you have a hole in your eardrum, and usually it's best if we remove that
This was
ourselves.
last week. If he's still there, is he gonna give me trouble?
I think he's probably gone on from now. But that's all that matters, right? But now, if we do see a lot of people that have things, I mean, it's sort of funny to talk about, but bugs that fly in their ear and things like that. If your eardrum's okay, usually you can use, again, vinegar is very safe. You can use peroxide as well.
Next time I'll pickle him and try.
Yeah.
Hope that don't happen again. It's very annoying,
Oh, it is. It's loud. Well, thank you all. We're going to let Dr. Kellam talk a little bit about sinusitis, and then we'll have. Okay, you got a question? Okay, all right.
With the swimming pools, with the salt and all, you still recommend putting like the solution, the vinegar solution in after swimming? Have you seen a reduce?
Right. So that's a good question. Is a lot of people are changing from chlorine pools over to saltwater pools. Is that going to change the rate of ear infections and all that? Basically, the answer is it's too soon. Nobody's done studies to know. Somebody that's prone to infections, I still recommend doing the same thing as before until we get more information. All right. I think Dr. Kellam's going to talk about sinusitis. Thanks.
Lord & Bolger Tree Service has dedicated their lives to protecting, maintaining, and enhancing the landscapes of our friends and neighbors all over Middle Georgia. Our highly trained staff is bonded and insured to protect your most trusted investment, your home and business. At Lord & Bolger Tree Service, our goal is to provide professional, high-quality, personalized service because we care about you, your family, and our environment. From the smallest to the largest, grinding those old stumps or taking down the largest trees, you can always depend on Lord & Bolger's 272-2903. Call us right now, 272-2903. Lord & Bolger's Tree Service, Dublin.
I'm Angela Magruder, a certified bankruptcy attorney.
The road to financial freedom may seem long, but doesn't have to be far away.
Bankruptcy can help, and now with our mobile office, we can come to you.
Weekend appointments available. Go from feeling financially drained to feeling in control.
In just one appointment. Our family helping yours on the road.
Glaze, McElroy, Magruder, and Kitchens. Our family helping yours.
Compare and save today on health insurance from Blue Cross Blue Shield of Georgia. Get quality health care coverage at a price you can afford. Talk to the representatives at Clements and Insurance today about our affordable health plans from Blue Cross Blue Shield of Georgia. Whether you're working without health coverage, retiring early, looking for family coverage or employment, or self-employed, we have a plan that's right for you. See Clements and Insurance, 503 Bellevue Avenue in Dublin, or call 272-8090.
We have served you for over 20 years, and we are owned and operated by physicians that are on the cutting edge of cancer treatment. You never have to drive miles and miles to get state-of-the-art treatment with the most advanced technology that allows us to treat cancer in a higher and more effective dose. CurePoint accepting patients right now. Call us today at 272-2255. CurePoint Cancer Treatment, Bellevue Road, Dublin.
Hi shoppers, Earl at the Piglet Supermarket over here on Highway 19. Our phone number is 272-2250. Come over here and shop with us this week. We got ground chuck, $2.39 a pound. We got pork chops, $1.69 a pound. We got spare ribs, $1.69 a pound. We got Boston butts, $1.39 a pound. We got lettuce, again, 99 cents a head. Cabbage, 39 cents a pound. We got some freeze pops over here, 50 count freeze pop box, just $8.99. We got bread, everyday low price, 99 cents for bread, hot dog buns, hamburger buns. Got onions, 3-pound bag, $1.69. Come on over here and shop with us at the Piglet. We appreciate you. We need your business. Come see us, and we do appreciate you. Thank you.
Slide here mentions allergies and ear infections, and everything's connected. The head bone's connected to the neck bone and so forth. And in the world of ENT, everything really is connected because, as we mentioned before, sinus and nasal problems lead to ear problems and so forth. And allergies, of course, impact ear and nasal function, obviously. So basically, when we say sinusitis, as people in medicine, we mean a bacterial infection of the sinuses. And then within that subset, there are some other things like allergic fungal sinusitis. They're different types, but I think out in the community, someone may say, I've got sinuses or I've got sinusitis, and it may mean something different. So, if you come in and you say, well, my nose constantly runs, it may be something as simple as allergy. And sometimes it's simply a matter of asking yourselves, what things trigger my problems? Can I avoid these? Usually there's some simple, safe medicines we can use to treat that. There are people who have a condition where they have chronic congestion and runny nose, and we call that a vasomotor rhinitis. And you can test these people for allergy, and they don't truly have an allergy, but they have just a hyperactive nose. And we see this more often in older patients for whatever reason. And it's almost as if the brain begins to send the wrong signals to the nose. And they'll say, when I sit down and eat, my nose runs. And again, this is one of those things that's hard to explain, but there are simple topical, drops and things we can often treat that with.